Welcome to this intensive exploring mental health and emotional well-being, giving you the opportunity to learn more about how we can support and work with the mental health needs of children and young people. We're going to be looking at key theory, emotional and mental health in the context of school, as well as key issues in practice, including confidentiality, safeguarding, and ethical dilemmas. By the end of this course, you will have developed knowledge and skills which will support you in whatever capacity you go on to work with children, whether that's through childcare, as a youth worker, teacher, or a social worker, or even a parent. My name is Lorna Coulter, and I've been working to support children and young people as a therapist for the past 10 years. I've worked with preschool children through to adolescence, facilitating safe and creative spaces where children and young people can express and explore what they're feeling and also develop their coping skills and resilience. This work has not only supported those with significant mental health needs, but also promoted good emotional well-being and mental health in the schools, hospitals and charities where I've worked. When it comes to children and young people, the statistics on mental health aren't good. Headlines often refer to a crisis in the mental health, with issues such as a lack of confidence, eating disorders, self-harm, anxiety, and that's just naming a few. All of these have a significant impact on the lives and outcomes of children and young people. That's why I believe this intensive is so important. There's such a need for us, as adults, to understand mental health in children so that we can consider how best to support them. It's essential that all children have the opportunities they need to achieve their full potential and grow into adults who are able to manage their feelings, ask for support when they need it, and be healthy. These are particularly important skills to be thinking about in the current context of COVID-19, where children and young people have experienced considerable change, uncertainty and loss. Support services might have been withdrawn, and children may have been finding themselves isolated from friends, wider family and school staff. There is a real concern amongst professionals that COVID-19 may result in heightened feelings of anxiety and worry and could impact on low mood and other mental health conditions. There's been a huge surge of children and young people accessing support through services such as Childline since the pandemic began and throughout lockdown. I just want to remind you at this point to take care of yourself throughout this intensive. Learning about mental health can lead us to reflect on our own mental well-being and sometimes highlight the need we might have for support. If that's the case, then you'll find information of different contacts that might be useful to you going forward. And I would always encourage you to seek out someone you can trust to talk through anything that comes up for you.